Hello, today I will be discussing the referral and eligibility determination process for special education services, the role of educators on the IEP team, and the importance of understanding development, assessment, and cultural context when evaluating students. The process begins when a teacher, a parent, or other professional refers a student for a possible special education services. Once the referral is made, the school must schedule a planning meeting, usually within 5 to 10 days. At this meeting, strengths and concerns are mentioned before the school can provide a child with special education and related services for the first time. The child's parents must give their written permission, according to the U.S. Department of Education 2000. Parents are told what evaluations will be done on their child. Under IDEA, the evaluation must be completed within 60 school days of receiving the parental consent, although some states may set shorter guidelines and timelines. Once consent to evaluate the student is received from the parent, a multidisciplinary team is formed, and this team assumes the responsibility of following all evaluation procedures. The multidisciplinary team members may vary due to suspected areas of the disability and the need for specific skill sets, according to Texas Education Agency 2023. If the student is found eligible, the special education teacher presents an individualized education program and placement, and the team decides if changes need to be made to these documents. From referral to the IEP development, the timeline typically falls within 65 to 70 school days. General education teachers provide essential information about how the student functions in their classroom, academic performance, participation, behavior, and response to interventions. Their perspective helps the team understand how the student compares to their typically developing peers in the general education setting. The special education teachers bring their expertise in specialized instruction and in the accommodations and modifications. They help interpret assessment results, they recommend services, and explain how the student's disability might affect learning across different settings. Together, they ensure the plan is realistic, individualized, and legally compliant. When evaluating students, the team must consider typical development milestones in areas such as language, motor skills, social emotional growth, and academics. This knowledge helps distinguish between a true disability and differences caused by the factors such as second language acquisition, inconsistent instruction, or lack of exposure to learning opportunities. Without this lens, there's a risk of misidentification. Special education teachers use a formal assessment such as the Wechsler Intelligence Scale for children to measure cognitive ability. They also may use the Woodcock-Johnson 4 test to access student academic levels. These tools provide standardized data to compare the student's performance with their same age peers. An informal assessment could be a curriculum-based measurement, such as a progress monitoring in reading or math. These show how well a student applies skills in the classroom over time. Results may always be interpreted considering the student's language, cultural, academic background, and family experiences. For example, a bilingual student may score lower on an English vocabulary test, not because of a disability, but due to limited English exposure. Similarly, cultural differences in communication styles or problem solving can influence performance. Eligibility determination under IDEA is a team effort with clear timelines and responsibilities. Understanding development using multiple assessments and considering cultural and environment ensures fair and accurate identification of students who truly need the special education services. Thank you.